All right, so good evening, everyone. Welcome. Thanks for coming. My name is Ted. I'm a PT1, and I will be tonight's moderator for the discussions that we have. So tonight we'll be discussing mental health, and first it'll be with Dr. Judith DeLorme-Loftus. We will be discussing mental health as it pertains to diversity, and then later on we will have Amy Dresner speak about her experiences with addiction and her experiences with the healthcare field. So a little introduction for our first speaker. Dr. Judith DeLorme-Loftus was born in New York City. She grew up in New Jersey, met her husband when they were juniors in college in New England. They married in 1972 and moved to Phoenix in 74. So far, her jobs have included working as a social worker with Cuban refugees in New Jersey, teaching junior high school Spanish, teaching as a bilingual teacher in first grade, and doing geriatric social work in South Phoenix. South Phoenix, teaching in high school, working as a hospice social worker and bereavement coordinator, mainly with Spanish-speaking population, and working to assist vulnerable adults in adult protective services. She started as the first Midwestern University counselor and has been working in student counseling services at MW since July of 2003. She has completed 800 hours of clinical pastoral education at Banner Thunderbird Medical Center in 2007 and 8 as a chaplain. Her husband and her are the parents of 3 adult children. She has a Bachelor of Arts in Spanish in secondary education, a Master of Arts in Spanish Language and Culture at ASU, and a Master of Arts in Religions from Fordham University in New York, and a Master of Social Work at ASU, and a Doctor of Ministry from Seabury Western Seminary up in Illinois. She volunteers as a chaplain with the Glendale Police Department, and she was the winner of the Littlejohn Award for service to MW community in 2014. So without further ado, I'll pass the mic on to Dr. Judith DeLorme-Loftus, and we'll hear what she has to say.
Thank you, Ted. Good evening, everybody. I'm very glad to be spending some time with you tonight. I appreciate the invitation, Ted. I also appreciate the topic. I think the topic is, it's a solid topic. It's a topic that we all, I've run into in my professional life, and you will run into in your professional lives as well. And certainly mental health is one of those concerns. As one of the 4 counselors at Midwestern, mental health is we laugh that we think we're the most important people on campus, because if you have mental health, you have everything. And I'm not sure that everybody finds that funny, but mental health is definitely, whether you're working, whether you're a student, I don't care what you're doing, we all need to be stable, and we all need to take care of our mental health. And so without further chat, we're talking about cultural diversity and mental health. I tried to make sense out of the topic in kind of a logical progression. So I'm going to give you some definitions so that we're all talking about these topics from the same perspective. So we're talking on this one, culture, race, and ethnicity. And we probably use those words almost interchangeably if we use them at all, but they really do mean different things. Culture is the social matrix of the whole human experience. So when you start out at Midwestern, you are within a culture, you're within a medical culture, you're within a student culture, but you're also in a culture with many different people who see the culture the same as you, but potentially who see the culture as differently than you see it. Race is identity, including physical identity and those inner qualities revealed outwardly. And ethnicity is belonging to a society, a people, or community. And what makes them a community, basically, is the common historical, geographic, linguistic, or religious beliefs that they hold. I thought this quote to me is one of these quotes, we should all have a t-shirt with this on it. Cultural differences should not separate us from each other, but rather cultural diversity brings a collective strength that can benefit all of humanity. And I didn't know who Robert Allen Arthur was, so I looked him up, and he is an American screenwriter, film director, and producer. So what is diversity? You know, we talk about diversity. Well, is there diversity? We have a diversity committee. What's the diversity plan? But when it comes down to it, you want to stop and scratch your head and say, well, wait a minute, just what do we define diversity as? And here it is. The inevitable variety in customs, attitudes, practices, and behavior that exists among groups of people from different ethnic, racial, or national backgrounds who come in contact. And certainly, whether in our past we say we have come in contact with different types of people, but certainly as people in healthcare professions, you are going to be coming in contact again and again and again with people that you may up till now have considered the other. But when we start talking or in our minds, thinking about people who are the other, I think that's when we're getting ourselves into trouble. As professionals, Ted, I gotta move you a little here. You're okay. As professionals working with diverse populations in the healthcare settings, we need to be aware of our strengths and our weaknesses, as well as our own individual cultural biases. And a lot of times we'll say, well, I'm not biased. I don't have any cultural biases. You know, in theory, I think everybody is just wonderful. And then something happens and you run into a person, or you run into a behavior, or you run into an attitude or a way of speaking. And then you say, well, maybe I do have a cultural bias. Maybe I'm not as good as I thought I was. So first of all, be open-minded. And what is open-minded? Well, everybody we meet, we can learn something from. We're not necessarily always willing or open to it or even interested, but we can learn from pretty nearly everybody we meet. You want to be receptive to a variety of ideas. Not everybody thinks the way I do. Not everybody thinks the way you do. I was born in New York City. There's how many millions of people in New York City? I don't think like all of them. First of all, there's an age difference. Secondly, there's a part of the age difference is a generation difference. There can be socioeconomic differences. There can be religious differences. And so we think we're open-minded, and we are, but that's something that we have to be on top of all the time. We have to accept that not everybody has the same beliefs, behaviors, thoughts, or actions to each other or to us. Not everybody thinks the same way I do. Not everybody believes the same way I do. Not everybody talks the same way I do. And so that doesn't mean they're less than me. That doesn't mean I'm better than them. All it means is there are differences. Look at life through a different lens, perhaps for the first time. Have you ever met anybody and they say something and you think, wow, you know, I have never thought of it that way before. And maybe we don't want to necessarily say that because we think it makes us look dumb or short-sighted or whatever. But I constantly run into people who look at life through a different lens. One of the greatest experiences of my life, and it was when I was 21 years old. I graduated from college with the bachelor's in Spanish and secondary education. All I wanted to do was teach high school Spanish. That was it. Well, the powers that be that year, and I won't tell you how long ago that was, but the powers that be that year were not in my favor, because I could not find a high school Spanish teaching job anywhere in Bergen County, New Jersey. And so I decided, well, the welfare board was hiring social workers. And so I thought, well, I'm going to go to the welfare board and I'm going to see if anybody will hire me. So there were 5 of us in line for one of the social work jobs. And the director of the agency said to me, Judy, we're hiring you. And I thought, well, that's good. And I said to her, why did you pick me out of the 5? And she said, the other 4 were social workers, but you can speak Spanish. And it's easier for us to teach you social work than it is for us to teach them Spanish. And so the new Cuban refugee social worker was born. my best teachers from that day till this one were those Cuban refugees. And when I look back on them, many of them were my age now, then. And to imagine somebody who's leaving their country, they came through Miami, how they made it up to New Jersey, I'll never know. But they had no home. They had basically the clothes on their backs and a few things in a tote bag. They had nothing. And so you can imagine when I came on the scene, I looked pretty good because I did know ways to help them out. But they helped me and they taught me and about courage and about acceptance and about making do and about being the best you can in a poor situation than any teacher I have ever had, PhD bar none. I mean, these were really, it was a phenomenal experience for me. And I was looking at life through a different lens. And so to be free and not bound by the collective view of family and friends, having your own view. We're all brought up in situations where, like, my father really didn't support the idea. Why did I want to work with Cuban refugees? And I remember saying, Dad, these people need help. It's not them and us, it's all us. And he thought I could have done better in the job department. And I thought I had struck gold because I still have never had a better teacher than those Cuban refugees. It was amazing. Now, I want to talk a little bit about mental health because that's part of this whole idea. What is mental health? We talk about, oh, I have to do this for my mental health, or, well, you know, what about mental health? Well, what is it? It is the condition of being sound mentally and emotionally that is characterized by the absence of mental illness and by adjustment, and that's important, especially as reflected in feeling comfortable about oneself, having positive feelings about others, and the ability to meet the demands of daily life. And let's face it, when you show up on that doorstep at Midwestern, there's a lot of demands of daily life put on you. You know it's going to be difficult, you know there's going to be a lot of work, but you don't really know what that looks like in lived out every day when the alarm goes off in the morning life. Then you have, especially when orientations were that we could actually meet each other in person and not like this, then you have that, how do I fit in? How do I get to know people? How do I look like I kind of got this when I don't really feel like I got this? And so all of this is going through our heads. And to me anyway, I've been in the same spot, but it's that kind of that check of how is my mental health? We don't think of it in those terms. Well, you know, I'm thinking about checking into my mental health. But when we start looking at, am I comfortable with me? Am I comfortable in this situation? Am I having positive feelings? Am I thinking that I'm never going to get this done? They're not going to like me. I'm going to fail. What's going on? And that all of this is a kind of a guide, or I guess a guide is as good a word as any, as to what does my mental health look like? And that can change from day to day. You know, I didn't do so well on yesterday's exam, so I don't feel so well today. But tomorrow I do spectacularly in something I have to do. And then I feel more balanced again. So mental health isn't always just the status quo. It has its ups and downs. And I think what you're looking for really is more ups and downs. And so there are myths of mental health. I think I put 3 of them. Mental health problems are not common is a myth, because mental health problems are common. If you looked, and we don't have stuff like this, so we don't know unless students tell us, but I can't imagine the percentage of students on our campus who are probably on either an antidepressant or an anti-anxiety medication. And that's not a criticism. That to me is okay. But we sometimes, oh, I don't want anybody to know that because that makes me sound like I'm off the beam or I'm falling off the planet. No. The World Health Organization estimates 450 million people worldwide are experiencing a mental or neurological disorder. So basically, we're in good company. In the US alone, the CDC estimates 1 in 5 Americans will experience a mental illness in a given year. That's 20%. I don't know if that's high or not, but you're definitely, when you have your down days, you're definitely not alone. And the number 2 myths, those living with a mental health disorder or challenge or unable to work. Yeah, that is a myth. They are unable to work. If I'm depressed, we can get to the point where I'm so depressed I can't go to work and maybe I need treatment. But if I take medication and I can stabilize the depression, yes, we can survive, we can be productive, we can work. So the person living with a mental health disorder can still work and be productive, even if they need certain accommodations. Contributing factors to developing a mental health disorder include genetics, stress, standard of living, working conditions, and lack of social support. And that's one of the things that worries me with this whole pandemic thing. A lot of the newer students that came, like this last academic year, don't necessarily have the knowledge of their fellow classmates or other friends on campus because of all this pandemic stuff. And so what does their social support, what social system do they have? And that is concerning. Myth number 3, those who are mentally ill will be mentally ill forever. No, that is not true. With proper treatment, now some of this is predicated on I have to seek out that treatment. We were just joined by 2 dogs, so I think they'll be okay. I don't think they'll bother us. But with proper treatment, medication, learning new skills, and therapy, patients can recover from mental health issues and live happy and meaningful lives. When I was in my late 30s, I was hospitalized for depression. And I was hospitalized for depression for 6 weeks. In those days, when you were hospitalized for depression, it was a pretty long time. And when I look back on it, the Irish grandmother that I was talking about before, I come from a long line of depressed Irish females. It almost seems like it's literally in the genes. Some of them were able to get treatment. My grandmother was able to get treatment, but some of them never did. And so with proper treatment, that's the key. And a lot of times it's the medication, but the learning new skills and the therapy helps. People can recover and people can live very meaningful and happy lives. For me, it was probably at that point in my life, the best thing I did for myself. But I can tell you at the very beginning, I was highly ashamed that I needed to be there. But when I left, I was really proud of myself for having the courage to make that step. In our own Midwestern environment, as counselors, it's our experience, and I started out, I was the first counselor that Dr. Kaczynski hired in 2003, and I was the only one there as counselor for about 10 years. And it was consistent from 2003 till right now, the 4 areas that we see students. There are other areas too, but these are the top 4. Anxiety, fear of, anxiety. Depression, those can kind of go hand in hand. Fear of failure. And the last one is relationship issues, because we do recognize that it can be difficult on significant others, especially if you move here from out of state. It can be difficult for some significant others to feel like they fit in or to either get a job or if they've got babies, whatever, because you as students, and you're the significant other to them, most of your time is spent studying. I had a wife say to me one time, is it possible he's trying to avoid me because he says he has to always study? And I said, I suppose it is possible, but the fact that he always has to study, I know is truthful. And so, once she thought she was getting a little perspective on it, she felt better. But I could understand if I had been her, I would have wondered too, is he just trying to avoid me? And I think the simple answer is probably not. He's just up to his eyeballs in science and math and stuff. So what are some signs of anxiety and depression? Depressed mood. And I mean, nothing makes you happy. I don't really want to eat. I don't sleep very well. I just kind of shuffle along through the day. And yet I don't want anybody to know I feel this way, so I try to hide it. A lot of work. This is a lot of work. So it's a depressed mood all day, every day, for days, months. It can bring, although for me it didn't, unintentional significant weight loss, not having any energy even after you've slept well, or at least slept a significant amount of time, feeling worthless or guilty, having a hard time concentrating or making decisions, and ultimately, when it gets to a point where it's bad enough, thoughts of death or suicide. It is absolutely, if you're sitting, standing, whatever, listening to this, if you feel like you could be depressed, to me, it behooves you like ASAP to go to see your healthcare provider as soon as possible if you think you may be depressed, because depression does not go away on its own. Sugar does not help it. Eating bonbons and hot chocolate does not help it. It needs generally medication and support. And sometimes what we don't realize is depression can trigger issues from the past, unresolved issues from the past. And sometimes it takes a little time to just sit down and talk about them. And it takes a little while, but you begin to feel like whatever normal is for you. So now we're into the cultural diversity and mental health. What you have to do as physical therapists and for me as a social worker and for people that are dental students, DOs, pods, I don't care who you are, you have to adapt, understand, and be patient. Not everybody looks at people that they regard as the other, as people they want to be around. But as people in healthcare, we don't necessarily get to choose those types of people, or those, if you want to use the word, qualities of people that we want to be around. You know, there's got to be, even in some of the work you've already done, there's got to be somebody with it when they come in, you roll your eyes and you're really glad to see them walking out more than you're glad to see them walking in. And you can't show it. Sometimes we don't even know why we feel that way, but we do. And so part of this whole process of cultural diversity and mental health is to adapt, to understand, and to be patient with yourself, but also with your patients, so that you can establish a good rapport with them. Many visit their healthcare professional and are confused, scared, and don't know what to think or feel. And they're relying on you or us to help them come to terms with what is happening to their mind or body. I was telling Ted earlier that I don't know how long ago this was. This probably was at least 10 years ago. I was a curler, the Canadian sport on ice. And I ended up falling on the ice and breaking my right shoulder. And it was not surgery worthy. They gave me a sling, they didn't set it, but they told me that I was going to need PT. And it's like, I have never had PT in my life. I associated it with pain and torture. And I was looking for a way to not have to do it. And I realized I was never going to be able to get range of motion in my right arm if I didn't, bite the bullet and go to PT. And I went to PT in our clinic. And it was, and I'm not just saying this because you're PTs, it was actually the smartest and best thing I ever did for myself. So kudos to all of you for the past work and the future work that you will be doing, because I really do believe that the only reason that I have range of motion with my right arm is because I went to physical therapy. What I didn't know I knew it was going to hurt. I didn't know how badly, but it wasn't intolerable. But I also knew just because it physically hurt me, it wasn't hurting my shoulder. In other words, it wasn't doing me harm. I just had to get on board with the fact that it was going to hurt a little, and it wasn't that bad. But that's what I mean when you say you go to your healthcare professional, you're confused and scared and you don't know what's coming. And the provider, Dr. Cardula, the male Dr. Cardula, was super. He really was. But that's what I mean when I say you rely on your provider, because I sure didn't have any idea what was coming my way. Each of us has a lot to learn. You know, I won't tell you how old I am, but I'm definitely several decades older than you are. And I still have a lot to learn. We have mucho to learn. When we are exposed to new or unfamiliar people, belief systems, ideas, customs, questions, or behaviors, that is the time to be grateful for the new learning we are about to experience. Not, oh, another one with a stupid question. Oh, this next one, they make no sense anyway. I don't know why they ask me that question every time they show up. Does not matter. You have something to learn from everybody you meet, even if you're constantly being asked the same question over and over. So look at it as good rather than pesty. Consider this. Being in environments where we meet people who are not just like us is a gift and an invitation for us to learn and expand our outlook on people and life in general. People that are just like me, if I spent my whole life with people just like me, my life would be the most boring life on the planet. I don't want to be with people that are just like me. I want to shake it up. I want to be with people that see life through a different perspective or through a different belief system or through differences. To me, the differences are almost what gives energy and life, not the fact that I like to hang out with people just like me. Once in a while, but not as a steady diet. And we need our eyes and our heart wide open so we don't miss these precious learning moments. And precious learning moments maybe sounds a little schmaltzy, but to me, when you're learning from others, they are precious moments. And when you get to be my age, maybe you get a little schmaltzy too, I don't know. This is my favorite slide of the whole slide thing. My grandmother was Catherine A. Gibney. She was the Irish one. She was the depressed one. She was the best grandmother I've ever had because I only had one. I didn't know the other one. And this is not a quote that you've never heard before, but I want you to really think of this when you go into your clinic settings or when you're standing in the grocery store and the woman in front of you is taking forever to put the bread on the belt. There is no them and us. There is only us. And with that, I will take questions. And Ted, can I make you bigger? If I click on what I can see of you, can I make you bigger?
I think you can pin a certain person by double clicking them if you want to make me take up the full screen.
You can actually stop sharing, Dr. DeLorme, and you'll be able to see the rest of the videos as well.
Thank you, Denise. Thank you.
All right, so we have our first question from the chat. Where do you think that the fear of people who are different from us comes from? That idea of if they're not us, they're them.
This is opinion, not necessarily fact. I think it comes from a lack of understanding. I understand, and this isn't even true either, but I think we think that we understand people who are kind of sort of like us, whether it's the skin color, the nationality, the religion, the age group, whatever it is. I think where we get a little afraid or uncertain is when we meet people that we realize are not just like us. And if we give ourselves the luxury or the time to reach out to those people, our world just got bigger and their world just got bigger. And that, I swear it was the Cuban refugees that opened my eyes to that. Because if you had said, who do you want to work with? I would have said, I don't know. But when they said I could work with the Cuban refugees, it was like, yes, because I knew that the only people who could teach me about them and the way they had to flee Castro's Cuba and live life in New Jersey was by interacting with them. And so I think some of that idea of the other, I don't know if it's to make us feel bigger about ourselves or more competent or confident. I like to think it's not a way to keep people down, but I think in some ways it's a personal decision we make that we want to be better than them. It's a little on the negative side, but I think some of it's true.
All right, I'll go ahead and ask some of the prepared questions. So what are some other, I know you listed some myths, but what are some other stereotypes or stigmas that you believe surrounds mental health?
What are some of the stigmas around mental health?
Mm-hmm. Stereotypes or stigmas?
I think some of the stigmas are old. They're not necessarily, they've never been like updated. I think some of them is if you're depressed or if you have anxiety, then, oh, you know, you can't control yourself, or what's the matter with you? You don't know how to take care of yourself. You don't know how to behave. I think a lot of it is you don't know and you should know. And it's like, if I've never necessarily been taught, like if I don't know how to behave in a PT class, you know, and everybody gets into the PT class and now we're going to learn X, Y, Z. Well, I'm not a PT student. I don't know how to behave. I know I'm going to sit there and shut my mouth, but I think some of it can be, we don't know what we don't know and we're afraid of what we don't know. And then that the second level is the desire for us to look good for our own sake in front of others. It's a little egotistical and maybe off the mark, but I do think some of that is at play.
And it looks like we have another question in the chat. It says, you said that you learned quite a bit from working as a social worker. Can you tell us about the greatest lesson you've learned from your experience as a social worker?
That's a tremendously great question, because that first job with the Cuban refugees was the foundation of everything for me. I think one of the reasons I learned so much about the Cuban refugees, you know, I'm a born and raised, you know, in New Jersey. I'm in the country I was born in. I can read, write, and speak the language. I understand the nuances. I understand the food. I can read and write, because these were people, as I told you before, my age, coming from Cuba, who could not necessarily read or write. I can remember one of them had a can, and it was carrots, and it didn't have a picture of carrots on the label. For some reason, I thought every can had a picture of the vegetable, but there was no carrot on the label. And I'm looking at the word carrots, and she said to me, I bought this because it was on sale, but I don't know what I bought. And I said to her that it was a zanahorias. It was carrots. And, you know, at that moment, I thought, you know, I just walk into the grocery store, I pick it off the shelf. I know what it is, but everything to them, at least for their earlier days in New Jersey, was a struggle. And the best part was this town that we were in was divided. So there were very wealthy people literally on the other side of the tracks. I'm not being funny. There were railroad tracks that went through the town, and the people that were the wealthy people were on the other side of the tracks. And of course, the Cuban refugees that I was visiting were on the south side of the tracks. And the priest in the Catholic Church had done missionary work in South America, and he spoke Spanish, and he had that it's all us mentality. So he was like my backup. I would call him when we needed mattresses or tables or chairs, and he would always be able to deliver something. And so what I found, the whole social work thing, was I admired people. Yes, they were forced out of Cuba, but they had the courage and the fortitude to keep moving forward. Life didn't stop for them because they were not in Cuba. Life continued. They just had to work a little bit harder at it. And one of my other hugely great teachers was a man, Mr. I can't think of his name. He had a PhD in English literature, and he used to teach English at the University of Havana. He had glaucoma and he was blind as a bat. And he used to ask me, please just describe, what does this room look like? Or what does this look like? Or what does this look like? And when I would go home from seeing him, I would literally cry going home in the car from seeing him, because he was so uplifting, but he was so, blindness really kept him from interacting.
All right, thank you for sharing that. Looks like we have another question in the chat. So how could we help a friend or a patient if we notice they are having signs of depression or anxiety or other mental health issues?
I think what we sometimes try to want to do is kind of come in the back door, but I also think honesty is key. I have a friend in New Jersey, and I talked to her last week on the phone, and she's usually very perky when you talk to her. Anita has always been the extrovert of the group. And I said to her, Anita, you sound very down. And I know Anita since freshman year of college. And I said to her, you sound very down and you're concerning me. Now she's going to listen to me because we have such a long relationship, and she knows that I work with people that are depressed. And so she said to me, what do you think I should do? And I said, I don't think you should make excuses as to why you shouldn't go and see somebody, but start, if you want to start with your MD or your DO, start there and see what they have to say. I do think we have to say something to our friends when we see something like that, but I think it can be done in a gentle way rather than a bat them over the head way. And it's like, I notice this behavior in you and I'm concerned for you, rather than you're no fun to be with anymore, get help.
All right, so we got another question for you. So how can we as future healthcare providers help to break down any stereotypes in order to better assist our future patients?
I think to make it clear to your patients that you are open to anything they want to tell you. So that if I'm trying to rehab the shoulder and I go in, but I'm feeling depressed, and you notice me being depressed or down, or my behavior has changed. Last week I was a little perkier and this week I'm not so perky. Just to say, I see a change in your behavior. How can I help you with that? Or, to get them maybe taught. You don't want to be doing therapy when you're supposed to be rehabbing somebody. But I think it's kind, thoughtful, professional to notice and say that you've noticed something. And to say, I'm not in the mental health field, but I see that your behavior has steadily gotten downhill over the last 3 weeks. Something where you noticed it, you acknowledge it, and then maybe you make a suggestion. Why don't you see your family practice doc and see what they can do for you? And some people may take offense to that. Some people will be grateful. So.
Very good to know. Thank you. Let's see, we got some more questions for you. How do you see these struggles impacting the field of healthcare if they are left unrecognized?
The struggles in,
Struggles of mental health.
okay. I think anything that's left unchecked is only going to get worse. And so I came from a home where you didn't talk about this kind of stuff because you didn't want the world to think you were crazy or sick or some who knows what. And I think today some of these issues are a little bit less threatening to talk about, but there's still going to be some circles where it's still considered to be taboo. That doesn't mean you can't speak the truth in a situation, but you may not like the response that you get either. But I think some of it is, I go back to, you seem a little different than you did last week. And, you know, you don't have to grab them by the chest and, you know, squeeze the collar of the shirt and say, you're really weird, buddy, you better get some help. But to gently lead them in a direction. You know, we're working on the body, but maybe you need to work on the spirit or the mind. Something that doesn't make you sound like a know-it-all, or that you're being chastising somebody, or you're calling them, you know, I think you're really weird, but that you're more looking out for their interest rather than criticizing or critiquing their behavior.
All right, we got another question. So what are some healthy coping strategies that students can utilize to become more aware of our own mental health?
That's an ongoing good question battle. And I think like what I kind of do, and this probably sounds a little weird, but what I kind of do before I go to bed at night, even working from home, but it was more so when I was actually at work, but I would go home at night and I'd almost like have a checklist. How do I feel I did today? You know, was I myself? Was I honest? Did I eat lunch or did I skip it? Was I trying to avoid doing something because I didn't have the energy? Was I making excuses? It's almost like just how was my behavior and how are my thoughts today? And does that put me in the plus column, or does that put me in the circle in the drain column? Because once we start to, especially with depression, you can go downhill pretty quick once depression just loves to get in there. And I picture this kind of getting in there and getting comfortable. And it's like, yeah, I really kind of like being with you because you do depression really well. And it's like, well, I want to stop doing depression. But to me, it's like, okay, how did I do today? What did I feel today? How did I respond today? Because like when this whole pandemic thing started and we were working from home, I did not like this working from home at all. And it's like, you know, it was just, to me, it was overwhelming. And being home, I don't want to be home. I want to be back at school. But over time, I kind of got into the rhythm. And I think that's the word I'm looking for, is to getting into a rhythm. So can I do kind of a self-check? How did I do today? And where do I need to improve? Or what am I proud of that I did today? Well, I did a really good blah, 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 blah. Okay. But it's like just kind of a check. How did I feel when I was doing this? Well, today I feel kind of down. Or today, you know, I called home and I found out my dad's sick. So now I feel a little down, whatever. But just to kind of know, where am I in the scope of my own daily living? That doesn't mean we have to hit the panic button, but to just have an idea and to even write a little checklist. Did I eat lunch today? Did I eat breakfast? Did I do any exercise? Did I meet with friends? Did I talk to anybody online? Things that keep me in the mainstream rather than I'm going to go sit in the corner and suck my thumb for the next hour. No, that's a little weird, but when you get depressed, you do weird stuff.
All right, and I have another question for you that I thought of. How do you think mental health is, how it impacts other cultures? Do you think it's the same, or do you think it depends on their background and their experiences growing up?
I think some of it's cultural. I do think some of it depends on the background, because when I think back, I never would have, this goes back to the question a few questions ago, but I never would have realized it. I saw people, the Cuban refugees that I worked with were fighters. They were people that, yeah, I'm not in the environment that I was born and raised in, but I'm in another environment and I've got to create a life for myself in this environment. And so some of the things that bother us or wear us out or whatever, we don't have to roll over. I think sometimes we have to dig a little deeper. And it's like, okay, how do I solve this problem? Because I think I basically believe we are problem solvers for ourselves. Sometimes we don't know where to begin. Sometimes we don't know where to end. But I think if I see this as a problem, how do I solve the problem? It's not that much different than being a physical therapist. I came in with the shoulder broken. You know, you're going to look at me and say, geez, that's too bad. But you're going to come up with something to rehab me. You're not just going to send me home and say, geez, you know, we feel bad for you. We'll put your picture on the refrigerator and think about you when we get a beer at night. But we're not really going to do much for you, because that's not the truth. You are going to provide what they need, whether they know it or not. That's, to me, the bottom line. Sometimes people don't know what they need. And sometimes, like even ourselves, we don't necessarily know what we need. So we got to do a little exploring to find out. Think of the people, I've talked to a lot of people, especially this in recent months. We didn't have the orientation that we normally have. So I know very few of my classmates. I'm an introvert and I know my roommate, but if I didn't have that roommate, I wouldn't know anybody. And it's like, okay, do you want to continue like that? Or do you want to find ways to reach out in a pandemic era that would be helpful to you to meet other people? Now, the extroverts of the group have that taken care of, but the introverts of the group don't necessarily have the same speed and drive that the extroverts have. But we all have the need to have contact with one another.
All right. Well, thank you for your answers. Really appreciate it.
You're very welcome.
That is all the questions I had, and I believe there are no new questions in chat. And it looks like we're doing pretty good on time. We'll give us, I think, about a 5-minute break from 6:55 to 7 in order to, if you need to go to the bathroom or grab a quick drink before Amy Dresner begins her presentation. So if there's any last-minute questions, feel free to send them in the chat. But other than that, I think we're just about wrapped up.
Thank you for having me, Ted, and everybody else. And Denise, it's good to see you. It's been a while.
Good to see you too.
Thanks for coming. We appreciate hearing all that you had to say.